Hello, my name is Ana Paula. I am in the first period of the Radiology Technology course at the Federal Technological University of Paraná. In this presentation I will address the topic: what is the function of the stimulator in the spinal column? What is a stimulator and what is its function? A spinal stimulator is a medical device that emits electrical impulses into the spinal cord to treat chronic pain. This device consists of thin wires called electrodes and a small battery that resembles a pacemaker or generator. These emit controlled electrical impulses that interfere with the transmission of pain to the brain. This action offers an alternative form of relief because instead of the patient feeling pain, they will feel a slight tingling sensation, commonly called paresthesia. How is a cord stimulator implant performed? There are two main techniques: percutaneous implantation, through a puncture. The doctor inserts tubular electrodes, and in this way the spinal cord can be stimulated. The advantage of this technique is that no cuts are necessary at the site where the electrodes are inserted. But plates cannot be used, and therefore the programming options are fewer. It is a less invasive surgery, however, it presents a greater risk of the electrode moving from the site where it was placed. Surgical implantation. In this technique, it is necessary to make a small cut in the posterior midline. In this way, under direct vision, a plate is inserted into the epidural space. In both techniques, general anesthesia is generally used and they are performed in a surgical center. Can the procedure be performed by the SUS? Yes, the path to be followed is very similar to that of those who have health insurance, which is as follows. 1. You must go to the health center and be diagnosed as having intractable pain. Then, you must be referred to a reference pain service. 2. Be treated effectively by a multidisciplinary pain team. 3. Be diagnosed as a case refractory to multidisciplinary treatments and then referred to a functional neurosurgery and pain center. 4. After evaluation by the neurosurgeon, the patient may become a candidate for a spinal cord stimulator implant, being placed on a waiting list for the procedure and performed as soon as it is available. It is worth remembering that the vast majority of patients, whether private or SUS, will show improvement in pain when treated by a multidisciplinary team specialized in pain. But when is it indicated? Some evaluation criteria are used to verify whether the patient is a good candidate for the procedure. The spinal stimulator is used when other therapeutic approaches, such as medications and physical therapies, do not provide good results or result in intolerable side effects. It can be indicated for neuropathic pain, complex regional pain syndrome, pain associated with vascular problems, among others. But before considering the implantation of the spinal stimulator, it is worth mentioning that patients undergo an extensive medical evaluation to determine the underlying cause of the pain and consider the response to other options. What are the benefits? A spinal stimulator can improve quality of life, reduce the need for pain medication, and allow the patient to return to their daily activities. What are the risks? In general, the procedure is safe and successful, but there may be some risks, such as migration of the electrode, which may stop working, bleeding, infection. To minimize risks, it is important to identify risk factors and assess the patient's mental health before surgery. This research suggests that spinal cord stimulators represent an interesting approach to treating certain cases of chronic pain. They are indicated when other therapeutic options fail. But it is crucial that the patient fully understands the benefits and risks associated with the procedure, including the possibility of surgical complications, infections, or displacement of the device. In addition, it is important to understand that spinal cord stimulators are not a definitive cure for chronic pain, but rather a management tool that aims to contribute to the patient's quality of life. I conclude my presentation with the references I used to carry out this research. I hope you enjoyed the content and thank you very much for your attention.